Hello, everybody, and welcome. It's Nurse Eunice with Florida Training Academy. In today's video, we're going to be discussing how to provide care to a patient with a tracheostomy. We'll give you about 10 seconds to receive your notifications, and today's review is focused on CNAs or Certified Nursing Assistants, and also the hospital level CNA, which is called a Patient Care Tech PCT or Patient Care Associate PCA. And we'll get started soon. Good morning, good morning, good morning. All right, so let me tell you about your patient, Mr. Davis. Mr. Davis is a 60-year-old male who was admitted to the hospital following a severe respiratory infection that required the insertion of a tracheostomy tube. Mr. Davis does not currently have a speaking valve due to concerns about his respiratory status and airway protection. Mr. Davis communicates through writing and gestures, but expresses frustration with his inability to speak. And so the illustration that I have on the screen is that of a tracheostomy with the purple cap on the end, which is a speaking valve. They may call it a Pessimir valve, but that's just a brand name. But the speaking valve should only be placed once the patient is stabilized. And don't forget, I know right now as a CNA or a patient care tech, that is not your role, but if you have the speaking valve on the patient's trach, the balloon must be deflated. You cannot cap off the trach and have the balloon inflated. And here's another example of a speaking valve, also known as one-way speech and swallow valves. It is a small removable plastic attachment that fits onto the end of the tracheostomy tube to help people with a tracheostomy tube speak so that they can communicate. So Mr. Davis is really frustrated. He had a respiratory infection, ended up trached, and now he's trying to communicate and no one can understand him. And you are the caregiver. So Mr. Davis is alert and responsive, but unable to vocalize due to the absence of a speaking valve. He appears anxious and struggles to communicate his needs effectively. The healthcare team is focused on managing his tracheostomy care and supporting his communication needs. And Durilyn, and I hope I pronounced that name correctly, I'm so proud of you for passing your CNA test. Congratulations, everybody. Please congratulate her. All right, let's continue. So now we are taking care of Mr. Davis. Question number 1. As a nursing assistant, what is the most appropriate initial action to take when you first meet Mr. Davis? Is it A, provide a speaking valve to Mr. Davis to facilitate communication? B, assess Mr. Davis's tracheostomy site and ensure proper tube placement? C, encourage Mr. Davis to use hand signals for communication? D, notify Mr. Davis's family about his current communication challenges? You are taking care of a patient with a trach. What is your priority? And this one tricked you. For this one, the priority is not communication. I'll reread the responses. If you are the CNA working with me and a patient has a trach, I need for you to know to look at the freaking trach. You have to be assessing the trach. So the correct response for this one, everybody, is going to be B. Yes, as a CNA, you're in there turning this patient. You're doing all types of things to this patient. Communication is important, but if you don't ensure the safety and the proper functioning of the tracheostomy tube, your patient is going to be at risk of respiratory arrest. So if you go in and that tube is not where it's supposed to be, or if the trach collar that provides the oxygen is not where it's supposed to be, you need to be notifying the nurse right away. So yes, we talked about communication, but we're communicating with a person who has a trach. So we have to think about both aspects, not just communicating with them, but also keeping them safe so they can continue breathing. Airway, remember ABCs. Airway is your priority. Question number 2, why might Mr. Davis not have a speaking valve at this time? A, speaking valves are not available in the hospital. B, speaking valves are only used during specific times of the day. C, Mr. Davis prefers not to use a speaking valve. Or D, there are concerns about Mr. Davis's ability to tolerate a speaking valve. Think about what I told you about the speaking valve. Yes, we want them to communicate, but we have to do so safely. And yes, everybody, I see D's coming through. So for this one, the correct response is D. Remember, he's still having some problems breathing. So yes, there are concerns about Mr. Davis's ability to tolerate the speaking valve. And so we're not going to put that valve on him until he is stable. So he's going to have to communicate a different way. Question number 3, what is the primary reason for performing regular tracheostomy site care? And if you haven't been taught this so far, it is okay. You're going to learn it as you go. But is it A, to prevent infection, B, to improve breathing, C, to enhance the patient's comfort, or D, to prevent the tube from dislodging? Why do you want to clean all that gunk from around the trach site? Anna Roll says A. Jessica, Anna, Sheena says A. Any more A's? Because I think the A's have it. And so the reason why you're cleaning around the trach is to prevent infection. You all that mucus, dried secretions, dried blood, moisture under a gauze is going to be a breeding ground for bacteria. So you want to prevent infection by A, regular tracheostomy site care helps to prevent infection, which is significant risk for patients with tracheostomies. Remember that opening in their neck and their trachea goes down and the germs can go right into their lungs. So we have to be very careful with how we care for them. Question number 14, which of the following is not a sign of tracheostomy site infection? Redness, swelling, clear drainage, or foul odor, which is not a sign of infection? Oh, I can tell I have you all thinking today. I have you all thinking. And Anarol, Claudia, Anna, Karen, Dania, Jessica, Pamela, you all are absolutely correct. If it's clear, we're not as concerned. So clear drainage is not a typical sign of infection. However, redness, swelling, and a foul odor are indications of possible infection. So if you smell something or you see something that doesn't appear to be correct, make sure you notify your nurse. Question number 5, what should be used to clean the tracheostomy site? Is it hydrogen peroxide, soap and water, alcohol swabs, or sterile saline? If you're old school, you're going to say peroxide. We don't use peroxide anymore, not in a healthcare setting. So it's not A. That is your hint. All right, for this one, I see that we're teaching you something new, and it looks like Karen and Erlina have it correct. It is going to be sterile water. So the correct response is going to be D. And so whenever your nurse sends you to go get your tracheostomy care kits, if the nurse is going to be providing the tracheostomy care, more than likely the cleaning solution is not in that kit. So you may have to go back and get the proper cleaning solution. And one of those solutions would be sterile saline. It's in a bottle. Your nurse will use sterile technique. And so if you're a CNA, remember for your CNA examinations, you cannot perform sterile skills. You cannot put on sterile gloves. But once you've passed your exam and you're working in a hospital as a patient care tech, you'll be taught sterile technique and how to perform sterile procedures. So we live near a military base, and so that sound you hear overhead is more than likely a military aircraft. So I do apologize, but sterile saline is recommended for cleaning the tracheostomy site as it is gentle and effective without causing irritation. Question number 16, what is the purpose of using a tracheostomy dressing? Is it A, to keep the area dry, B, to prevent the tube from moving, C, to absorb secretions, or D, all of the above? And if you've not seen a tracheostomy dressing before, you'll see it on the next screen. Oh, you all are amazing caregivers because you all knew it was D, all of the above. So, tracheostomy dressings help to keep the area dry and to prevent tube movement and to absorb secretions. And I'll make sure I show you that dressing on one of the subsequent slides. Question number 7. Which action should a nursing assistant take if they notice increased secretions at the tracheostomy site? Increased is the key word. Is it A, change the tracheostomy tube, B, suction the tracheostomy, C, notify the nurse, or D, clean the site with alcohol? Ouch. We're not doing D. Perfect, team. Yes, perfect. I am so proud of you. Everybody knew to notify the nurse. See, so the increased secretions at the tracheostomy site can indicate infection or other issues, and the nurse should be notified for further assessment and intervention. Question number 8. Why is it important to secure the tracheostomy tube properly? Is it A, to prevent discomfort, B, to avoid accidental dislodgement, C, to reduce the need for suctioning, or D, to maintain oxygen levels? Why do we use those ties to secure the tracheostomy? Hmm. So, teaching you something new. I've not seen a correct response yet. Now I see correct responses. So Helen and Anna, yes. So you all, the correct response is B. So it's hard to see it because we're looking at it from the side, but the gauze that is beneath the tracheostomy tube, that is the tracheostomy gauze. It is actually split in the center so it can go around the tube, and that gets really yucky. So that's the second thing you're going to look at as a CNA. So actually, third thing. First, you're going to look at your patient's face. Talk to your patient, even if they can't communicate with you verbally. They can do thumbs up, they can do thumbs down, they can nod their head appropriately. Then after that, you're going to be looking at that trach site to make sure it's midline, to make sure you're not hearing any strange sounds. Then look at that gauze, and then look at those ties, the ties that go around the neck, because if they're saturated, it takes 2 people to switch those out. You never want to be the person doing trach ties changes alone, because if the tube becomes dislodged, if the tube comes out, it's going to be hard for you to put it back in, and that's going to cause a medical emergency. So those ties prevent dislodgement or the tube from coming out of the trachea. Question number 9. What should be done if a tracheostomy tube becomes dislodged? The best nursing team, it is going to happen. That's why we keep their hands restrained initially so they don't try to go to their throat and pull out their tube. But what do you do if it happens? Is it A, do you attempt to reinsert it immediately? And this is from the CNA, the PCT standpoint, not from the nursing standpoint. Is it B, call for immediate assistance? C, cover the stoma with a sterile dressing? Or D, give the patient sips of water? Absolutely not. So, what do you think the best response is? Everybody, I'm so proud of you. You're saving lives. Yes, you call for immediate assistance. It is B. Look at that team running. You tell us that someone's tracheostomy has come out. Oh, we're not going slow. So, if a tracheostomy tube becomes dislodged, immediate assistance is required to ensure the patient's airway is maintained. And remember, it's in their throat. And when it comes out, if they pull it out accidentally, it could be bloody. So, it could be a bit traumatizing, not just for you as the CNA, but also for that patient. So you get those nurses, the rest of that team in ASAP. Question number 10. Which observation should be reported immediately when monitoring a tracheostomy site? Is it A, slight redness, B, minimum clear drainage, C, difficulty breathing, or D, mild discomfort? Revealing the correct response in 3, 2, And you all have it. Yes. Difficulty breathing. So I couldn't put an image on here because YouTube loves to flag my videos. I'm just trying to train the babies and they don't want you all seeing anything gross. So your homework assignment is to go to Google, type in the word mucus plug, and then click on an image. And so whenever the trach secretions get dry, or when the person hasn't been suctioned enough, they could experience difficulty breathing. And that's a critical observation that should be reported immediately because it could be due to a blockage, such as a mucus plug. And when your nurse comes in, if she's not able to advance that catheter to suction those secretions out, she can always remove the inner cannula. So some of your trachs have an inner cannula that can be removed. We take one out, put a new one in, and hopefully the patient will feel better faster. But it's all because you, as a CNA or PCT, actually noticed the patient having difficulty breathing and got that nurse in there. Question number 11. Why might pulse oximetry readings be misleading in African American patients? Is it A, their skin pigment may affect the accuracy? B, they have higher baseline oxygen levels? C, they often have smaller fingers? Or D, they do not experience respiratory issues? I see some A's, I see some B's. I see way more A's than I see B's. All right, so we're going back and forth between A and B, and you all, the correct response is going to be A. Because of the skin pigment, it affects the accuracy. So skin pigmentation affects the accuracy of pulse ox readings, sometimes giving falsely normal readings despite underlying issues. And so whether your patient is African American, dark skinned Hispanic, dark skinned Asian, if they're still having difficulty breathing despite normal pulse ox readings, you need to get that nurse in the room because more than likely there is an issue. And so, Johns Hopkins University, the School of Public Health, at the very bottom of the screen, there's a website you can go to. It's Johns Hopkins. sph.libsyn.com, and they've done a whole research on the racial bias in pulse oximeters because sometimes your patients will be ill, they're not breathing well, but the pulse ox is showing a normal reading, and this is a worldwide problem. So now you are aware, and I want to thank Sharon P. for sending me that article so I could include it into this presentation. Question number 12. What should be the immediate action if an African American, dark-skinned Hispanic, dark-skinned Asian patient shows signs of breathing difficulty but has normal pulse ox readings? What do we do, team? Is it A, ignore the readings and assume they're fine? B, administer oxygen based on pulse oximetry? C, conduct a brief assessment and notify the nurse? D, repeat the pulse oximetry in a different finger? And yeah, you can do D, but give me a different answer besides D. That's right, team. That is right. That's how we're going to keep our patients safe. When I say a brief assessment, like 15 to 20 seconds. If there are signs of breathing difficulty, remember airways always your priority. Despite normal pulse oximetry readings, a brief assessment should be conducting. What are you assessing? Their face. What do they look like? Look at their chest movement. Are they struggling to breathe? Are their stomach muscles moving? So if all that's happening, their respiratory rate is 24 and it was 12. So if you're seeing changes in their breathing pattern, I don't care what that pulse ox says, get your nurse in there. All right, question number, we're on a different segment now because you all have been doing such a great job with Mr. Davis on this shift. I now get to give you an update. So Mr. Davis's tracheostomy site is stable thanks to you, and he's receiving routine tracheostomy care. He continues to communicate through writing and gestures, but expresses frustration with his inability to speak. Question number 13. What is an appropriate response to Mr. Davis's frustration with his inability to speak to you? Is it A, you'll be able to speak once you fully recover? B, let's explore alternative methods of communication. C, try not to think about speaking right now. D, you'll need to get used to not speaking. All of my D responses have been sucking. They're just inappropriate. So, team, what do you think is the best response for question number 13? Yes, great job. And so B was the correct response. And what I have here is an illustration of a communication board. So if you have somebody who speaks a different language, or if you have somebody who has a tracheostomy and they can't speak to you, you don't have to try to read lips. Number one, give them pen and paper. If their hands are released and they're unrestrained, that means that they're not at risk of pulling out their trach. So give them pen and paper. But you can always go to your nurse's station, ask the secretary, do you have a communication board? And the communication board will have the Wong-Baker scale where it goes from them smiling to them crying. It'll have a picture of a toilet, pictures of cups of water. And yes, some of your patients with trachs can still have small amounts of ice. They still need mouth care for comfort. So, but this will help you communicate with someone. And don't forget to use thumbs up and thumbs down and also head nods. Question number 14. What can you do as a nursing assistant to support Mr. Davis's communication needs? A, provide a speaking valve without consulting the healthcare team. B, encourage Mr. Davis to communicate less to conserve energy. C, offer to write down any messages or questions he has. D, discourage Mr. Davis from expressing frustration about his inability to speak. Yes, I am extremely proud of you. You're going to offer to write down any messages or questions that he has. And if the family comes in, you can ask them just to do something as simple as go to one of the dollar stores and get a dry erase board and a dry erase marker. And that way he can write down his request and then he can erase it so that he'll have it ready for his next request. All right, so he is ready for discharge. You have been working at Nurse Eunice's nursing home / hospital for a whole shift. You've taken great care of Mr. Davis, and Mr. Davis is now stable and he's preparing for discharge. The healthcare team is discussing patient education and preparing him for managing his tracheostomy at home. Question number 15, what education should be provided to Mr. Davis regarding his tracheostomy care and communication after discharge? Is it A, avoid discussing your tracheostomy care with family members? B, practice maintaining good hygiene around your tracheostomy site? C, stop using gestures in writing for communication. Or D, you don't need to follow up with any healthcare providers after discharge. You all know that hand hygiene is so important. Remember, we talked about if he has the germs around his trach site, let's say he touches it and then he rubs his eye, well, he's just transferring these germs. So B, practicing and maintaining good hand hygiene around your tracheostomy site is extremely important, even with like using the bathroom, doing number one or number two, not washing his hands properly and then going to his trach site. That's going to be transferring germs. So he has to be very diligent about the hand washing techniques he provides at home. Question number 16, and this is not necessarily you making the referral, but it's you knowing about the process. So question 16, what referral should be considered for Mr. Davis to support his ongoing communication needs? Is it A, refer Mr. Davis to a physical therapist for rehabilitation? B, refer Mr. Davis to a nutritionist for diet counseling? C, discharge Mr. Davis without any referrals? Or D, refer Mr. Davis to a speech therapist for communication assistance? I mean, like every video, I do my nurse dance. So I'm over here doing my nurse dance today because I'm so proud of you. And you know that as a good caregiver, we have to include other care providers. And one of the care providers we're going to include for someone who has difficulty speaking is going to be D. He's going to need a speech therapist. And so think about the kids who have maybe like a cleft palate, or someone who has had a stroke who can't speak, someone who's had a tracheostomy who's having speech difficulties. So speech therapist can assist Mr. Davis's communication abilities and provide strategies in order to help him improve his communication skills until we can put that speaking valve on him. And I am so proud of you all. You have provided great care. You recognize the signs of respiratory distress. You reported the concerns to the nurse. You provided trach care. You made sure you got the sterile saline and not the hydrogen peroxide. Really important. You addressed the healthcare disparities regarding that pulse ox system, and that you knew that darker skin tones, sometimes it doesn't read their pulse oximetry. It doesn't get the O2 sat correctly. And so you knew to notify that nurse. And then you assisted with his discharge teaching. And guess what, everybody? Mr. Davis is now home with his family, and they were able to close up his trach. That's right. A trach is not always permanent. A trach can be reversed once the person improves. So I am so proud of you. Remember, this is Nurse Eunice with Florida Training Academy. My website is fltraining.com. We do have videos, we have study guides, we have a whole bunch of resources for you. So if you need anything, feel free to reach out to us, and I'm proud of you. And I'm going to try to come back tomorrow with another video. If not tomorrow, definitely Thursday. So everybody, I'm praying for you. Good luck for those who have to take their test this week. And for those of you all who have contacted me who have already passed, congratulations. I appreciate you, and I congratulate you. Bye, everybody.